Many people think heart health is only about the body. They think it is only about blood pressure, cholesterol, or exercise. But mental health is also an important part of heart health. Today, I want to talk about how mental health and heart disease are connected. This information is based on guidance from the Centers for Disease Control and Prevention, also known as the CDC. Mental health includes how a person thinks, feels, and acts. It also includes how a person handles stress, makes choices, and connects with others. Mental health affects the whole body. This includes the heart. Mental health conditions can be short term or long term. They can affect mood, behavior, and thinking. They can also affect physical health. Research shows that mental health problems can place stress on the heart. Some mental health conditions are more closely linked to heart disease. One of these is depression. Depression can cause ongoing sadness, low energy, and loss of interest in daily activities. When depression lasts a long time, it can affect the heart. People with depression may have higher heart rate and higher blood pressure. They may also have changes in blood flow to the heart. Anxiety is another condition linked to heart disease. Anxiety can cause constant worry, fear, or panic. When anxiety lasts a long time, the body stays in a state of stress. This can raise heart rate and blood pressure. Over time, this can harm the heart and blood vessels. Post traumatic stress disorder, also called PTSD, is also linked to heart disease. PTSD can happen after a person experiences a very stressful or traumatic event. This can include war, violence, accidents, or natural disaster. People with PTSD may feel fear, anger, or distress for a long time. Their body may stay in a state of high alert. This long term stress can affect heart health. Chronic stress is another important factor. Chronic stress means feeling stress or overwhelmed for a long time. This can come from work, caregiving, finances, health problems, or life events. When stress continues, the body releases stress hormone like cortisol. High cortisol over time can damage blood vessels and raise heart disease risk. Mental health conditions can affect the heart in two main ways. First, they can affect the body directly. Stress, depression, and anxiety can increase heart rate and blood pressure. They can reduce blood flow to the heart. They can increase inflammation in the body. Over time, these changes can lead to calcium buildup in the arteries and heart disease. Second, mental health conditions can affect behavior. When someone is struggling mentally, it may be harder to care for their health. They may smoke more, they may be less active, they may eat less healthy foods, they may forget or avoid taking medicines as prescribed. These behaviors increase the risk of heart disease. The connections also work on other way. Heart disease can affect mental health. After a heart attack, stroke, or heart failure, many people develop depression or anxiety. This can happen because of pain, fear, or worry about the future. Financial stress after a heart event can also affect mental health. Mental health support after a heart event is very important. Some medicines used to treat mental health conditions can also affect heart health. Certain medications may increase weight, blood sugar, or cholesterol. This does not mean this medicine should be stopped. It means healthcare providers should carefully monitor heart health. Some groups may be at higher risk because of mental health and heart disease together. Veterans are one group. Many veterans live with PTSD related to combat. Study shows this can increase the risk of heart disease. Women are another group at higher risk. Research shows that depression and PTSD can increase heart disease risk in women. Couples can be also affected. When one or both partners have PTSD, stress and conflict may increase. This stress can affect heart health for both people. Racial and ethnic minority groups may also face higher risk. Stress from discrimination, social inequity, and adverse life experiences can affect mental and heart health. Addressing mental health early can help reduce heart disease risk. Support, counseling, and treatment can help people cope with stress, anxiety, and depression. Mental health care can also help people adopt healthier habits and quitting smoking. Healthcare providers play an important role. Talking openly about mental health and heart health helps patients feel supported. Screening for mental health concern during heart care can improve outcome. For patients and families, awareness matters. Recognizing signs of mental health concern is important. So is recognizing signs of heart disease. Talking with a healthcare provider about both mental and physical health is a strong step. Family history and genetics also play a role in heart disease risk. Knowing these can help guide care. Healthy daily habits support both mental and heart health. Regular physical activity helps reduce stress and protect the heart. Healthy eating supports the body and mind. Good sleep helps both mental health and heart health. I want to share one key message. Mental health and heart health are connected. Caring for the mind helps care for the heart. This video is for educational purposes only. It does not replace medical advice. If you have concern about your mental health or heart health, please speak with a qualified healthcare provider. Thank you for taking the time to listen.